Direct-to-implant reconstruction is when we place an implant at the time of the mastectomy. So instead of doing a two-staged approach, which there's a video on that with expanding the area and then placing an implant at a second surgery, our goal is to place an implant at the first surgery. And there's a small opportunity to do that in certain populations, typically someone with a fairly small breast, someone who wants to be very similar size, someone who ideally will have all their skin kind of preserved during the procedure, can keep the nipple, and the nipple is in good position. Now there's some variations that we can do different than that, but typically to do it safely and to do it with the best results, those are the types of patients who would benefit best from that. So at the time of the procedure, we place an implant, and we have lots of sizes, and we use a device in the operating room setting that helps us to pick which volume implant is going to look the best. But what we do is we also use a piece of cadaver tissue, which is used safely in the body in all places. It is not considered on-label use by the FDA, so we have to tell you it's an off-label use, which means it's not been directly tested for this specific purpose, but it's safe in other regards in the body. And so we use it very safely around the implant as a way to tack and hold the implant in the right position. A lot of times that mastectomy pocket is too large and the implant would shift and move around and not be in a good position. So the piece of cadaver tissue, which incorporates into your body, it's safe, will help to hold things in place and have a good result then from a positioning standpoint.